Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about a topic which is measles. Measles is an acute infection which is sudden and severe. It is an acute infection which is sudden and severe. Basically, it is seen in childhood. Most children gets this disease and it is transmitted to contact. It is transmitted by contact, by sharing the cloths and sharing the foods. It is transmitted from the infected person and it produces skin infection. Mostly this measles produces skin infection and it is also endemic. Endemic means for particular area of people this diseases arise, and it is seen in this measles is seen in Asians and Africans because it is endemic. Particular area of people this diseases arrive. Now we will see the mode of spread of this disease. The mode of spread is it is transmitted by contact and it enters into the body. It is transmitted, as I have said, it is transmitted by utilizing the clothes as well as sharing the foods from the infected person. It enters into the body and it enters into the respiratory tract and it enters the respiratory epithelium and it multiplies there by replication and it spreads to lymph nodes. It spreads by lymph node and enters into the blood, which is known as viremia, and it causes skin infection as I have said above. This is the mode of spread of the measles. It enters respiratory tract, multiplies there and it spreads through lymph node and enters into the blood, which is known as viremia, and causes skin infection. Now we will see the clinical features of this measles. These clinical features is divided into 4 stages. First one is incubation stage. Second one, prodromal phase, exanthem phase, reconvalescence phase. These are the 4 stages of the measles. Now we will see the incubation phase. Entry of microorganism, entry of the microbes and the appearance of the first symptom. The time period taken between the entry of the microorganism as well as the first symptom. This time period is known as incubation period. It is 8 to 10 days. The time period taken between the entry and the appearance of the first symptom is called incubation phase. Here there is no symptoms seen in this phase. There is no symptoms seen in this phase due to the first symptoms is produces the entry of the microorganism, the appearance of the first. The time period taken between these two, so that there is no symptoms produces. So there is no symptoms takes place in this phase. It happens from 8 to 10 days, and you will see the second stage, which is prodromal phase. Prodromal phase, here it happens in 11th to 14th day. Here the fever, cough, pharyngitis and conjunctivitis is mostly seen, and there is a characteristic feature which is colic spots are seen. It is mostly seen in buccal mucosa. It is one of the characteristic features of the measles. Now we will see the third phase, which is exanthem phase. This is a maculopalpular rash are seen. Maculo means flat skin discoloration. There is a flat skin discoloration in the skin, and papular rash means raised and bulbous. This flat skin discoloration is raised as well as bulbous. Reconvalescence phase. Recovery. Here the hyperpigmentation is seen. When we take the samples of the measles patient and seen in the microscope, there is giant cells are seen in the microscope. These giant cells were found by Wathin and Finn-Kenley. So it is also known as Wathin's Finn-Kenley giant cell. Now we will see the complications of this measles. When we doesn't cure the measles, we treat the measles properly, it leads to complication. First one is it weakens the immune system and it leads to the complications like diarrhea, pneumonia, encephalitis, even it enters to coma as well as death. These are the complications of the measles. Now we will see the diagnosis of the measles. Mostly it is based on the clinical features. As I have said, there is 4 stages of the measles: prodromal, incubation, exanthem and reconvalescence. These are the 4 stages. From there we can diagnose the patient, and as well as there is increased level of IgG as well as IgM in the blood, and we can diagnose by PCR test, which is polymerase chain reaction test. Now we will see the treatment. It is treated by antiviral and antipyretics. Because it is transmitted by virus, so it is antivirals are given, and antipyretics. The patient feels fever, so antipyretics are given, and it can be prevented by MMR vaccine, which is the 2 doses are given. The first dose is given for 9 to 15th month, and second dose for 4 to 6 years. These are the doses which are given. In first 9 to 15th month means while the baby is born, from 9 to 15th month the first dose is given. From the age of 4 to 6 years the second dose is given. Thank you. You have seen all about the measles. If you like this video, please to like, share and subscribe my YouTube channel. If you have any doubt in it, please to comment it. If you want any other topic, please to suggest in the comment box. Thank you. Please to subscribe.